Welcome to Smell-Bell-Verbal Indian ENT model. Now today we are going to see, last time we have seen the normals of the skull. Now we are going to see the sutures of the skull. So we are trying to have a skull drawing. This is a model of the skull, of course. We are trying to have the coronal suture. So this is corona, just like a crown, as people thinking, and we are trying to mark it with the permanent marker, and this is how we are following an average pathway of this coronal suture. Of course, this is not exactly like that. This is the coronal suture going. This is the frontal bone. These two are the parietal bones. Now going toward, this is the sphenoid bone, and this is the temporal bone. We are going till the level of this sphenoid bone, above the sphenoid bone, on the right side and also on the left side. We are trying to go towards this side. So this is how the coronal suture or coronal plane is going to be there. Next part is going to be the sagittal plane. We are going to go for the sagittal plane. Sagittal is in the exactly in the center of this particular skull at the vertex region, and we are trying to draw the sagittal plane like this. And the sutures are just like intertwined lines which make the skull bones stick together. So this is the sagittal suture, as we are going to see from the upper part of parietal in a median plane. So this is the parietal bone, this is the parietal bone in the medial plane. It is there almost like this. So we are going near normally straight, if not like a exact suture line. Next is the lambda suture between the posterior border of the parietal bones and upper border of the occipital bones. So this is the posterior border of the parietal bone. We are going to go towards posterior part of the skull. This is the occiput. So we are having the occipital protuberance here. From here, lambda suture called as lambdoid suture. Posterior part of this parietal bones, which we are going with here, these are prominent. Maybe this is a model depicting prominent sutures. So this is the lambdoid suture, which we have gone till this level, going till the level of our mastoid process. So this completes the basic sutures which are there on the upper part and the posterior part of the skull. So we can basically divide them in such a manner that we have got the differentiation of frontal bone, parietal bones. These are the temporal bones here, and this is the occipital bone and occipital protuberance. These are the mastoid processes. Next part will continue with another model drawing. Thank you very much for watching Smell-Bell-Verbal Indian ENT models. Thank you for watching Dr. Smell-Bell-Verbal Indian ENT models designed to understand better ENT subject for residents and also sometimes patient information literature for the patients.